community-based practice, and my goal in Lincoln is to make this community a healthier place, meaning less drugs, more health. And so tonight I'm going to challenge you to maybe do something different and to take this information and just share it with somebody that may have a thyroid issue, that may be struggling with those issues, and help them to understand what might be causing their thyroid problem, because we're going to go over that tonight. Here's the things we're going to cover. What is a thyroid and what does it do? What are the symptoms of a low thyroid or a thyroid that doesn't work? What are the things that cause thyroid dysfunction? And we go into lifestyle, toxic, metabolic, all of that. Thyroid and gut function, very important. How do we evaluate the thyroid? How can you evaluate it at home? And natural treatments for low thyroid. So the thyroid, as most of you know, is this butterfly-shaped gland. It's right at the base of your neck, right here. And you basically shouldn't be able to feel it very well. And if you can, if it's inflamed, there's a problem. Now, anytime a new patient comes in my office, I always check the thyroid. I always feel for it. I feel for any kind of inflammation, anything that might be going on down there. And then, because if there is a problem there, we might want to investigate it. Now, the thyroid gland influences the rate of metabolism in the body. So it produces T4, and T4, which is thyroxine, is converted to T3, which is triiodothyronine. And so TSH, now this is your typical lab test that you get in a physician's office. TSH does not measure thyroid function, it measures pituitary function. TSH is not a thyroid hormone. It's a pituitary hormone. So the thyroid stimulating hormones produced by the pituitary, it stimulates the thyroid to produce T4. Elevated TSH stops this process through a feedback loop. So what happens when TSH stimulates the thyroid to produce T4, T4 goes up in the blood, the pituitary senses that, and it turns down the production of TSH so the thyroid doesn't overproduce T4. So if your thyroid is unable to produce T4, okay, the TSH eventually goes up. Here's the problem with measuring TSH as a thyroid hormone, is that I've seen this many, many times in practice. I've seen people with a very normal TSH, and I test thyroid autoimmune markers, and they're just sky high. They've got an autoimmune thyroid with a normal TSH. They'll go to their physician will say, your thyroid's fine. It's not fine. I've seen it over and over and over. And we'll talk about why that is in just a few minutes. Okay, elevated TSH usually indicates a thyroid dysfunction or pathology. So TSH should generally be, it depends on the lab and who you talk to, should generally be below 2, okay? Some people say, well, it's below 4. But if I see a TSH 5 and above, I know there's something probably going on with the thyroid that isn't right. Now, let's look at the functions of T3 and T4. Number one is they increase temperature and metabolic rate in the body. They increase the breakdown of fat. They play a really important role in normal growth and development. So a lot of these special needs kids out there don't have a thyroid that's not working right. We'll go and get into that, why that is in a few minutes here. Has a direct effect on the heart rate, has a significant effect on bone turnover, and affects the central nervous system and is very essential for mental development. So T4, these green things are iodine molecules. So the only difference between T4 and T3 is T3 is missing an iodine right here. It's the only difference, okay? I won't get into what reverse T3 is right now, but that's the only difference between T4 and T3. Now, think of T4 as crude oil that's pumped out of the ground, okay? And think of T3 as crude oil that's been refined into gasoline. So your thyroid makes T4, and then it's converted to T3 in the liver and other tissues in the body. So what are the signs and symptoms of thyroid dysfunction? Anybody think of any right off the bat?
Fatigue.
Fatigue, yeah, that would definitely be one. It's fatigue, okay? What else? Anybody?
Gain weight.
Weight gain, yeah, okay. You should open up your own office there. What else? Anything else? Okay, well, let's look at hyperthyroid first. So goiter, big goiter in the neck, rapid heartbeat, warm, fine, moist skin. I don't see hyperthyroid very often in practice. Atrial fibrillation, nervousness, weight loss, increased appetite, insomnia, increased bowel movement. So this would be somebody with a goiter right here. All right. What I see more is low thyroid. So there's fatigue, poor concentration, difficulty losing weight, brittle, striated fingernails, constipation, depression, headaches, rough, dry skin, joint pain and stiffness, excess earwax, hair loss in front and back of the head. Now, people with low thyroid don't have all of these. Sometimes their only symptom might be fatigue. Sometimes it might be depression, or you might have a lot of them. Just depends on the person. And loss of 1/3 of the eyebrow. Now, I want to talk to you about posture and thyroid because I'm really big on posture. There is a posture that reflects low thyroid, and it's pretty easy to pick out, and I see it all the time when I'm doing postural analysis. Does anybody know what that is or remember anything I've ever told you in the exam room? Carmen's shaking her head. She better know. That's all I can say. She works for me. Okay? So anybody know? Okay, so I'm going to show you what it is. So when you stand posturally, your hands should stand at your side like this. Now, somebody with a thyroid problem usually will have their hands, one or both of them, turned in like this. So they'll stand like this instead of like this. So if somebody comes in and I look at their posture and they're like this, I'll always ask them, if I don't know, do you have a thyroid issue? And if they say, not that I know of, well, I know they do. It hasn't been expressed yet. When the hands turn in like this, always thyroid. So if you see somebody standing, just standing around and their hands are at their legs, and they're turned in like this, they've got thyroid issues.
Why is that?
Why is it? It's a great question. It's because the teres minor muscle, which allows you to do this, it's one of the rotator cuff muscles, is associated with the thyroid gland. All your muscles are associated with a different organ in the body, every single one of them. So when that organ is weak, okay, that will weaken the muscle, and the muscle will not work or act right, okay? So here's another one, and I don't bring this one up very often, but the deltoid or the latissimus dorsi muscles are associated with the pancreas. Those are the muscles, these muscles right here. So when somebody's got blood sugar issues and a pancreas issue, a lot of time they'll come in with a shoulder that's real high. But there's other things that can cause a high shoulder too. That's the issue. But a bad pancreas can cause high shoulder. So all muscles are associated with organs. Weak organs will cause an associated weak muscle. So let's look at common problems often caused by thyroid dysfunction. Anxiety and panic disorder, obesity, sexual dysfunction, edema, fibromyalgia-like symptoms. And speaking of fibromyalgia, this Saturday I'm doing a talk on fibromyalgia at Natural Grocers. If anybody's interested in that, that'll be at 2 o'clock at Natural Grocers, and that's part of my community outreach here in Lincoln. So this information came out of the Journal of Affective Disorders, 2002. So a lot of people don't, they don't necessarily associate some of this with thyroid, but thyroid can cause it. Doesn't mean that that if you have one of those, it's automatically caused by the thyroid, but it certainly can be. So lifestyle factors which lead to diminished thyroid: high stress, elevated cortisol levels. Okay, where does cortisol come from?
Adrenals.
Who said that?
Adrenals.
Good job. Adrenals. Been in my talks. You ought to be able to wake up in the middle of the night and say adrenals. It comes from adrenals. So I said it so much. Okay, yeah. High stress and elevated cortisol levels. Okay. Where are your adrenal glands?
In the back above your kidneys.
Right on your kidneys. Okay. And what are they the backup system for? Anybody remember? Sex hormones.
Yes.
Yeah. So you don't have a backup for your thyroid, but you have a backup for testosterone, estrogen, and progesterone. Okay, chronic dieting, this yo-yo dieting will really screw up the thyroid. And there are a lot of people that have that. Weight gain, just chronic weight gain and obesity. Toxic exposure. Okay, what's a toxin that we're exposed to a lot? That's in a lot of our food. Glyphosate, okay, yeah, and atrazine would be another one. These farm chemicals, diabetes, dietary issues. Now, this is a huge issue. We're going to talk a lot more about this. This is a huge issue in thyroid problems right here. Is gluten sensitivity. Okay, lack of exercise. Any of these factors can lead to hypothyroidism. Okay, the role of the adrenal glands. The adrenal glands and the thyroid are sort of joined at the hip, okay? So what happens is the adrenal glands help normalize endocrine function. Adrenal glands help your body resist stress. They support stamina, immune function. So the thyroid and adrenal go together like two players on the same team. The problem with the thyroid and the adrenals is this. The thyroid is probably the most abused gland in medicine. The adrenal is probably the most forgotten gland in medicine. I mean, if you go to an endocrinologist, probably the biggest majority of their practice is thyroid and probably diabetes, okay? But the problem is you talk to a physician about adrenal function, it's like they can't conceive of what you're talking about. But the adrenals are really, really important, and a lot of times thyroid problems are really adrenal. It's really adrenal dysfunction. So you have to look at the adrenal glands as well. So if you have a consistently low body temperature, we'll talk about taking body temperature here in a minute. Consistently low body temperature is a thyroid problem. Okay, so you take your temperature every day, it should be 98.6. So let's say you take it every day, and every day for 14 days, and it's like 97. Okay, stay right around 90, 97.1, 97.2. You got a thyroid issue. But let's say you take it for 14 days, and one day it's 97.1, the next day it's 98 or 96.5, and it just kind of goes up and down, up and down. That's an adrenal issue. So it's not a thyroid issue, it's an adrenal issue. And that's something you can do at home. You don't need me or anybody else. You just take your temperature, and an erratic, something that's just kind of up and down erratically. That's classic adrenal dysfunction. So let's talk about metabolic and toxicity factors that diminish thyroid function. So liver dysfunction, big factor in thyroid dysfunction, because because your T3, one of the areas that your body converts T4 to T3 in is the liver. Kidney health usually diminished from medications, heavy metal accumulation, and I talk a lot more about that in my talk on toxicity. Fluoride, pesticides, radiation, dioxin, phthalates, all can affect the thyroid. Essential mineral deficiencies, selenium, zinc, and iodine. Now, selenium is the number one mineral that I see lacking. And when you see a normal T4 and a low T3, it's almost always a selenium deficiency. So where do you get selenium? Anybody know? One of the biggest places
Brazil nuts.
What?
Brazil
nuts, yeah. And you get it in, you can get it in yeast. Your nutritional yeast has a lot of selenium, and you get selenium. There's a lot of foods that have selenium in too, but those are the two biggest areas. Medications can cause thyroid issues. Medications cause a lot of issues, but beta blockers, birth control pills, and birth control pills just throws off the entire endocrine system. Estrogen therapy, lithium, chemotherapy, and glucocorticoids like progesterone, prednisone. Prednisone is a man-made, basically cortisol. Cortisol is a form of cortisone, man-made cortisol. It's going to throw off your adrenal function, which can throw off thyroid. So cutting-edge research right now on autoimmune thyroid is showing that most people with autoimmune thyroid, it starts in the gut, leaky gut. And I can show you two studies, really, really good studies by really prominent people who are talking about this, is when the gut is not working right and you're getting bacteria in food, undigested food, and toxicity going through the gut wall into the blood, that produces autoimmune problems. This is the major cause of autoimmune issues in our culture today, is leaky gut. And it's being written about in the literature all the time. You see all kinds of articles on that. This has to be addressed. This has to be looked at when you're looking at autoimmune thyroid disease. So Dr. Aristo Vijani, one of the top immunologists in the country, stated in this journal, Clinical and Cellular Immunology in 2017, that foods are a major source of autoimmune disease, intolerance to certain foods. So what are they? Wheat, gluten, and wheat products, pasteurized dairy products, foods high in lectins, okay? So does anybody know what a lectin is? Okay, you will in a minute, all right? We'll get into that in a minute. So if you, Hashimoto's, let's talk about Hashimoto's. Here's the problem with gluten and thyroid, is gluten looks a lot like thyroid tissue to the body. So it's called molecular mimicry. So what happens is if you have you have antibodies circling around in your body, and if something that your body is reacting to, like gluten, has part of it looks like the thyroid, okay, like that much looks like the thyroid, then the body going after gluten that it's intolerant to will start going after the thyroid because gluten mimics the thyroid. This happens a lot in autoimmune disease. So that's why it's absolutely essential that people with thyroid issues get tested for gluten intolerance, because if they're eating gluten, they got thyroid problems, they'll never get over it as long as they're eating gluten. So, yes, processes molecular mimicry. Let's look at lectins. Lectins are a form of protein found in all kinds of plants. And they basically the lectins are the part of the plant that protects it from insects and disease and mold and things like that. And all plants have lectins, but some have a lot more than others. And some lectins are a lot harder on the body than others. So, for example, gluten in wheat, that's a lectin, okay? But other lectins are found in legumes, for example, in beans, in nightshades, such as tomatoes, potatoes, eggplants, and peppers. And so you could have an intolerance to lectins. You could have an intolerance to something that you're eating that you think is healthy. But if you're intolerant to that lectin that's in that food, that can cause autoimmune issues. So research shows that Hashimoto's is associated with the four autoimmune triggers. Number one is dietary. You can have a genetic predisposition. Infections like Epstein-Barr would be one. And external influences like toxic chemicals, drugs, heavy metals, food sensitivities, and environmental chemicals. And we're all exposed to chemicals all the time. I mean, you can't even go to the store, and you've heard me say this before, you can't buy anything that's not in plastic. Well, phthalates are toxic to the thyroid and to the body, and phthalates are part of plastic. You can't buy anything that's not. I mean, even the organic stuff you buy is in plastic, so we're all exposed to it. That would not be my first place to go if I was looking for autoimmune thyroid. I'd look at leaky gut and gluten sensitivity probably before that. But that is a place to look. And we're exposed to heavy metals all the time. Like coal-burning power plants give off mercury. Mercury is in coal. Their coal contains mercury, and it gives it off, and we're exposed to that. Hashimoto's is also associated with a lot of other autoimmune diseases. For example, celiac disease, vitiligo. You see these people with these white patches of skin. That's autoimmune. They've got an autoimmune issue, probably undiagnosed. So they need to have their gut looked at, and they need to have food intolerance tests done. Alopecia, loss of hair. I remember years ago when I was in Hastings practicing. This is in the 90s, and a woman came to me with alopecia, and I thought, I could just adjust her and her hair will grow back. Well, that didn't work out like that, because now I know, which I didn't know then, she probably had a gluten sensitivity and an autoimmune disease that was causing that. But back in 1995, we didn't know that. I mean, we knew some things about. I knew that there were food intolerances back then. I just didn't know the extent of how they affected our bodies. So, some of these Down syndrome, Turner syndrome, which are serious special needs problems, some of those are autoimmune as well. So, symptoms of Hashimoto's can show up 9 years before autoantibody tests are positive. So you can have symptoms before the tests are positive. Here's another thing that can happen. The test can start going up and you have no symptoms. Okay, so it can go both ways. So how do we evaluate the thyroid? So iodine is an important measurement. Okay, so iodine, you want to evaluate iodine. Iodine's really important because iodine modulates estrogen and breast tissue, and low iodine plays a role in uterine fibroids. Okay, it doesn't mean you need to go out and take huge amounts of iodine. You don't need that much iodine. And your body recirculates iodine pretty well. Okay, the problem is that, like in this part of the country, there's no iodine in the soil. So the food grown in the Midwest really lacks iodine. I'll talk about how to figure out your iodine levels in a minute. So iodine is involved in the conversion of estrone to estradiol to estriol, which is E1, E2, and E3. What causes low iodine? Well, we talked about insufficient soil iodine, but intake by other halides like bromine and fluorine. So what's in our water? Fluoride, okay? So fluoride can affect iodine. That's why I don't drink tap water. Where do you get bromine from? Does anybody know?
Flour, or it's in bread.
Yeah, it's brominated.
Yeah.
Remember when we were kids back in the, well, some of us were kids in the 60s, okay, 50s, 60s, all right. Remember they used to have iodized flour back then? They used to have iodine in the flour, and then they switched it to bromine. And so bromine is toxic to the thyroid, okay? So how do you know if your iodine is low? Here's the simplest way, okay? I mean, they used to have, there's all these fancy iodine tests out there that, you can use urine, and now they have a blood test for it. Just look at your total T4. If your T4 is low, total T4, you have an iodine deficiency, okay? So I would say if it's lower than 7, okay, 7 to 9 is a sweet spot for T4. But, if you come in with a 4, your iodine's low, okay? So you probably need to take some iodine, all right? But you don't need a lot. I mean, you don't need to pound it down you just take some, all right? So what are sources of bromide? We'll talk about that. Flame retardant, hot tubs, medications. We talked about brominated flour. Brominated vegetable oil. I mean, Mountain Dew, Gatorade, Squirt. I think they stopped putting it in Mountain Dew because, gosh, somebody just got on them about it and wouldn't stop. And I think they stopped putting it in there. But brominated vegetable oils, you'll see a lot in soft drinks. And so every time I see somebody walking around with a Mountain Dew, I just want to walk up and say, did you know you're destroying your health? Why are you drinking that? Sources of fluoride, okay? Mouthwash, bad news for fluoride, okay? Public drinking water, toothpaste, fluoride dental treatment. So I don't even use toothpaste. I use baking soda, have for years. And the reason is because of the fluoride. Now I know there's some toothpaste that you can get that doesn't have fluoride, and they're fine. Tea, just normal tea, has fluoride in it. Now, here's the difference between this and this and this, is that natural things that contain fluoride, your body can handle that pretty well when it comes in like a food, whole food. What it cannot handle well is when the fluoride is added as a chemical into something that you put into your body. There's a big difference with that. Processed cereal, wine, beer, and soda, and medications have fluoride. Like some of these antidepressant, Prozac, Paxil, the fluoroquinone antibiotics, okay, have fluoride in them. So, we're just bombarded with things that kill our thyroid, okay? And so you think that about 10% of our population right now, at least 10%, is on some sort of antidepressant, antipsychotic drug. So you wonder, why are there so many people with thyroid issues? Well, there you go, right there. It's in, and then the fluoride in water and the way people eat, and how many people eat processed cereal for breakfast? We're told to do that. I mean, I haven't eaten any in decades and decades. I mean, processed cereal is what? It's basically cheap grain, sugar, and chemicals. That's what cereal is, okay? So, don't eat it. So measuring thyroid with temperature tests. So this is something you can do at home. So body temperature reflects metabolic energy state of thyroid. So a temperature below 98.6 is less than optimal. So you could take body temperatures 3 times during the day, 3 hours apart. You do it first thing in the morning. There's a thing called a gerotherm thermometer, which I guess, I don't have one, but it's supposed to be pretty easy to get. You can get them in drugstores. You can do it 30 days on a graph, although in about 3 days, you're probably going to know how well your thyroid is working. Because if you come up with a 97-degree temperature 3 days in a row, you probably got low thyroid. Okay. So lifestyle measures for low body temperature. Stress reduction, exercise is really good. Like short sprints, detoxification, organic foods, avoiding gluten and other lectins and aspartame and excess alcohol. I mean, these are basic things for health. Adequate rest, good whole food multivitamin, good nutrition. Why not use levothyroxine or Synthroid? What's wrong? Why shouldn't we use that? Well, first of all, this is T4. Synthroid is a T4. If your body can't convert T4 to T3, it's not going to work very well for you. Here's the problem, is that if T4 doesn't help with impaired conversion, it can worsen it. So if symptoms don't improve with T4 containing medicine, if they do improve, they tend to recur when T4 is discontinued. The only time that, I'm not saying you should never take this medicine, but the one time you really need it is if your thyroid is taken out. If it's, they kill it with radiation, which I have a patient that happened to. They gave her radiation or some sort of plutonium, or they killed her thyroid, and it gave her breast cancer. And so she's not real interested in doing like these medical procedures anymore. She just wants to be healthy. So if you don't have a thyroid, then you probably do need to take some of this. But if you've got a thyroid that's working, let's get it working so it works better. So this is my favorite test for gut function, is the Wheat-Zoomer test. Wheat-Zoomer test tests intestinal permeability, all aspects of intestinal permeability, and it tests all aspects of intolerance to wheat. So not just gluten. There's a whole lot of other things in wheat that you can be intolerant to. The Wheat-Zoomer test tests all of it. It's very, very specific. I use it a lot in
Is that
practice.
a blood test?
Yeah.
Oh, it is.
Simple blood test, tube of blood. That's all it is. Yeah. So here's another test that I use a lot. If I want to do, like somebody comes in and says, I think my thyroid may not be working right, would you test it? I would do this test right here. We look at, it tests TSH, total T4, free T3, free T4, reverse T3, and then it looks at autoimmune antibodies. And you can get an enormous amount of information about the thyroid with this test. And that's just a tube of blood as well. If somebody comes in and they've already got a TSH and T4, free T3, free T4, usually I'll just do the two autoimmune thyroid tests just to see where they're at. And, if those are okay, then we know that their thyroid is probably not autoimmune, and we can look at it a little bit differently. Okay, the thyroid is an autonomic nerve supply. I've seen thyroid respond to chiropractic care. And if we look at some of the essential nutrients for thyroid, vitamin A, think of ACE and magnesium and selenium. You want to remember the essential nutrients for thyroid. It has to have these: vitamin A, vitamin C, vitamin E, magnesium, and selenium. So think of ACE and then magnesium, selenium. There's some herbal products that are really helpful for thyroid. Google myrrh, blue flag, bladderwhack, ashwagandha. Ashwagandha and bacopa, really good for adrenals. For autoimmune thyroid, I would do Thytrophin PMG, and there's some other products I have that are good. So you can dose these according to your temperature. So say you have low thyroid, you can, based on your temperature, you can start, taking a few things and see if it works. See if it brings the temperature up. So you can do a lot of this or some of this at home, okay? You don't even need a doctor really to do it. I mean, you'd probably have to get some of this stuff from me, but you could do a lot of this on your own. So low-level laser, I've seen low-level laser work really well for thyroid. I have some patients that, so if we look at the summary of thyroid dysfunction, there's a lot of factors that can affect it. Toxicity, mineral deficiencies, leaky gut, food intolerances, low adrenal function. Body temperature is a good way to look at it, to measure it. And functional medicine protocols, detoxification, nutrition, low-level laser, and several other things can really restore thyroid function. So, you guys probably know people that have thyroid issues, So if those people are not getting better, if they're struggling, send them in, okay? Tell them to come in. Let me at least talk to them about what might be going on. Because most of these tests that I showed you are not done in your typical medical clinics. Most of the tests that I see on thyroid is just the TSH. That's completely inadequate, okay? The wheat zoomer test, the food intolerance test, they're not even on the radar of most physicians. And it's not because they're stupid, it's because they're taught differently. And so we can help a lot of those people. And I want to help those people. Sometimes it's just a matter of getting off wheat. That's all I need to do is get off all wheat, all gluten. Sometimes the thyroid will resolve. But sometimes it needs help if it's really been beat up for a long time. And if you have multiple autoimmune diseases, then you need to do a little bit more thorough testing. So, any questions on anything I've covered? Yes?
So can you say that if you have thyroid issues, low thyroid, what's the percentage of being gluten intolerant?
For low thyroid?
Yeah.
Probably in the 90s.
That's what I thought.
Yeah, it's real high.
Yeah.
It's really high. And I've seen some that come in with thyroid issues that, their autoantibodies are fine. Mm-hmm. They're good. Mm-hmm. And so you're going to just give them thyroid support. And I've seen people do really well on that. But, if you have really low thyroid and you've had it for a while, you got to get off gluten. You got to do that. You can't cheat every now and then. Well, I have spaghetti once a week, That's not going to work. Mm-hmm. Okay, you can't do that.
Unless you have gluten-free spaghetti.
Yeah.
Yeah, well, if it's gluten-free, but it has like wheat starch in it and you're intolerant to wheat starch, it's going to...
Or chickpea pasta.
Well, chickpea might be okay.
Chickpea is good.
Okay.
Is lectin a blood test to see if you're intolerant to lectin?
Yeah, Vibrant, the wheat zoomer people, they do a test called leptin zoomer.
Oh, okay.
And you can get that test done and find out if you're intolerant to lectins. They do a dairy zoomer. You can do they have all kinds of, these tests are really very specialized and very accurate. So yeah, it's a very good lab. Okay. I probably wouldn't do a dairy zoomer. I would just say, avoid all pasteurized milk products. That'll save you some money, and it's just, it would probably work, Mm-hmm. Like I'm pretty intolerant to milk, so I know to stay away from it. I don't need a test. Mm-hmm. I just know if I drink milk, I don't do very well, mm-hmm. So I don't need a test to figure that out. Mm-hmm. Anybody else? No? Clear as mud. Okay. Good. So next, if you want to come to and listen to my fibromyalgia talk, I'm doing that. Natural Grocers, 2:00 Saturday. Okay. Probably in the middle of the game. Yeah, I don't know,
it's a 6:30 game.
Oh, it's a 6:30 game.
Yeah.
Okay, so we're good there. Okay. All right. Great. Thank you very much for coming tonight. I appreciate it, and let your thyroid friends